Hi, everyone. Thank you so much for watching. We're so excited to have Josh with us from the Health and Medicine Council in Washington, D.C. They've been a great resource for Mission MSA as we've been building our advocacy efforts and working to make sure that the MSA community has a voice on Capitol Hill. Josh is going to give us just kind of a quick overview of the current advocacy landscape, what we need to know as we prepare for our virtual Hill Day coming up here at the beginning of September, and how we can make the most of those conversations with Congress. So I'm going to hand it over to Josh now to give a brief overview.
Great. So thank you, Ella. And yeah, hi, just to introduce myself again. I'm Josh Fine, work, in DC on behalf, of Mission MSA. Yeah, I've been lucky to work with the community now for, around a couple of years and been involved, in growing out, Mission MSA's advocacy efforts. So what I'm going to do is just give a quick background of, what's going on, in Washington, DC, what's been happening, in the past several months, what should we expect as we look towards the end of this year, and then I'll talk also a little bit about just some of our specific legislative priorities. So first off, really just wanted to highlight and really thank everyone who participated in our second annual Capitol Hill Day earlier this March. We convened rounds of the late 15 to 20 advocates from the community to Washington, D.C., really just to share, our stories, to educate members of Congress about MSA, the challenges, that the community faces, and of course, ask, for help, with some items legislatively that, we think will be great for the community. So we are excited that, we saw more people attend this year, than last year, and hope that every year, moving forward, the number continues, to grow. But advocacy is really important for representing your personal story, but also the entire MSA community, and making sure that we're being considered, when legislators are considering, important policy decisions. And yeah, as Ella mentioned, we are going to be having future advocacy efforts, such as a virtual Hill Day. So similar to in-person meetings, except meeting over Zoom, with your members of Congress. So, really hope to see more folks joining that, moving forward later this year, and into next year as well. So what's been going on, in Washington, D.C., a few main items that I'm going to hit. Right now, we're in the second session of the 119th Congress. There's midterm elections coming up in November. Congress has to deal with some issues, before they start campaigning, such as the appropriations process. And then I'm also going to talk about some other activities that the federal government has been working on, including the National Point and Parkinson's, and some policies that the administration has been trying to implement. So just a quick recap on, where things stand with appropriations. So earlier this year, Congress finalized the fiscal year 2026, spending bills for labor, health, and human services and Department of Defense, which has, key programs related to medical research, and public health, that the community cares a lot about. We were happy to see that medical research, was supported once again, seeing funding increases for the DoD research program, small funding increase for the NIH, and public health, was around level funded. But those spending bills go until September 30th. So what Congress has been doing now is that for the past several months, they've been working on the fiscal year 2027 appropriations process. The House of Representatives has completed all 12 of their appropriations bills. They did what's called markup. So they wrote up bills, and voted on them. And all of those, have gone through. I'll talk a little bit about some specifics of the bills, in a moment, but they've moved forward quickly, on their process and finished those bills up around the end of June. The Senate, on the other hand, has still been engaging in discussions. The Senate goes through a very, deliberate bipartisan process, and they've still had disagreements on what key funding levels are going to be overall for the spending bills. So the Senate hasn't done any of their appropriations markups yet, but we're expecting, to see that most likely sometime, in September. However, the main thing right now is that the House and Senate have to find, a solution and pass what's called a continuing resolution, a temporary funding bill, by October 1st to avert a government shutdown. As some of you might remember, last year there was a record-breaking government shutdown. that stretched from October until mid-November. So this year, with the election coming up in November, Congress is certainly hoping, to seek avoiding, another shutdown because it's very disruptive, for federal agencies, even congressional offices themselves. And so they have until October 1st, to do that. The House and Senate are both on recess right now, so they're back home in the districts, but they'll be coming back in September and they'll have a few weeks to figure all this out. Before they left, both the House and the Senate passed different versions of a continuing resolution that would temporarily fund the government until around December. So they have to, come to some sort of an agreement and pass the same continuing resolution before they leave for final campaigning in October. But what are some of the community's fiscal year 2027 appropriations priorities? We're aligned with the broader patient advocacy community and asking for a 51.3 billion for NIH for FY27. The budget right now for NIH is around 48 and a half billion dollars. So this would represent around 7 to 8% increase, which we're hopeful to see. Congress has provided large increases for NIH over the past decade, although they've been slowing a bit recently. So we want to see the continued overall funding level for the top at NIH, because we know that ultimately that's going to mean more money for MSA, that trickles down to institutes like the NINDS, the National Institute of Neurological Disorders and Stroke, that mainly takes the lead on the MSA research portfolio. And the CDC, their current budget is around $9 billion. And so we're aligned with the broader patient advocacy community and asking for over an $11.5 billion for FY27. And we also support a program called the Chronic Disease Education and Awareness Program, which is meant for conditions like MSA that don't currently have any line item funding, at the CDC. So organizations, like Mission MSA can potentially apply through this program, receive funding to do education and awareness activities across the country. That program has been funded at around $4.5 million for the past few fiscal years. So we're asking for a $2 million increase to $6.5 million for the upcoming fiscal year. So what are some of the key items that were mentioned or that were included in the House's FY27 bill? The House engaged in more of a partisan process, but our understanding is that all of the funding levels that are proposed by the House will essentially be the floor for the negotiation. So we're expecting that the Senate is going to have even higher funding levels when they do their bills in September, and then they'll have to come, to an agreement and kind of be in the middle when they're finalizing the bills in what's called the conference process, which is most likely at the end of this year or early into next year. But what was included in the House's bill? So they gave a $100 million increase for the National Institutes of Health. They level funded an agency called the Advanced Research Projects Agency for Health, which does more transformative, kind of risky, but potentially, transformative research. And they propose cuts, to the CDC and the Health Resources and Services Administration. But we're expecting, that those cuts most likely will not go through, in any final bill. And they also continue to support other research program and agencies like the Department of Veterans Affairs and the Department of the Defense Research Program as well. Along with the funding levels, they did have some promising language on things like indirect costs, which has to do with how much money goes towards kind of the other factors of medical research, like building, staff, things like that. But the administration has tried to limit. Multi-year funding, which has to do with giving researchers funding for a 5-year grant at the same time, which basically artificially limits the amount of total grants that NIH can give. And then it also had strong language supporting more research for rare diseases and highlighting some patient care issues like prior authorization and set therapy that have been problems for many of the patient advocacy community, for a long time. We also wanted to highlight the ongoing efforts and really the beginning of the implementation of the National Plan to End Parkinson's Act. So this all stems from a bill that was signed 2 years ago, in honor of Jennifer Wexton, who a former congresswoman who has PSP. And this bill essentially dictates the federal government to start a national plan to combat Parkinson's and related disorders like MSA. So the first meeting by the Advisory Council on Parkinson's Research Care and Services was in June. And this meeting convened speakers from all across the federal government. So this is a plan that it's being coordinated by NIH, by the NINDS, but it involves many, many different agencies. So at the meeting, FDA, CMS, even agencies like the DoD, the EPA, the VA, all of them were involved and presented and talked about how the federal government is going to work together to make progress in research for conditions like Parkinson's, MSA, and other related disorders. And Mission MSA is lucky enough that they're going to be one of the organizations that is also presenting specifically on what our community wants to see from the National Plan to End Parkinson's at the second meeting that's upcoming on August 24th. So certainly something very exciting, and we're hopeful that the council will take into account our recommendations as it move forward on this very broad, comprehensive plan. Lastly, before I touch upon some of our specific legislative items, I also wanted to acknowledge just some things that have been going on, with the administration and policies, that they've been trying, to implement. So most notably, there's been a lot of discussion about a recent rule that was proposed by the Office of Management and Budgeting that would essentially overhaul how every single grant and cooperative agreement works across the entire federal government. So this is not only research, it's agriculture, it's the VA, it's housing and urban development. The administration wanted to essentially change the process for how grants are administered, and they wanted to implement something called political interference. It kind of disrupts, the normal process, where people of these agencies just kind of decide on merit. So, of course, for the medical research community, we don't want to see political, biases get involved in the medical research process. So that's why there were hundreds of thousands of comments that were submitted to the Office of Management and Budget, basically saying that this is a really bad idea, and it'll be very disruptive, and please consider withdrawing the rule. The rule had been proposed to be implemented starting October 1st, but the Senate, in their continuing resolution that they passed, actually put in language that would block the implementation of this rule. So it's something that the research community, patient advocacy community has been very concerned about, and will continue monitoring it. But it certainly seems like on Capitol Hill, and there's broad bipartisan consensus that it's not a good idea and that this rule should not proceed. A couple other things is that NIH also put out a request for information on the amount of grants that a single researcher can potentially get awarded. This could be a little problematic for rare disease communities like MSA, where a lot of the research might be done by specific researchers and academic health centers. And then lastly, there's an ongoing discussion with the HR1, the One Big Beautiful Bill that was passed last year, which affects Medicaid and work requirements around the definition of medical frailty, which basically decides who is too medically ill, to have to, work or not. So it's something that's being kind of figured out right now and in the courts, but another thing that we'll be monitoring moving forward. And then lastly, I'll touch upon just a couple of our bills that we're very supportive of. So one is called the Healthy Brains Act. This is a bill that was introduced by Representative Subramaniam out of Virginia, who took over for Congresswoman Jennifer Wexton, and Representative Gus Bilirakis, who's the co-chair of the Rare Disease Caucus in the House of Representatives. And what this would do is that it would mandate HHS to conduct a national program, specializing in research into environmental factors that contribute to diseases, such as MSA. So it's a bill that's broadly supported, not just by us, but also by others in the Parkinson and related disorders community. And then lastly, another bill that the community is supportive of and that we were advocating for in March, it's called the Credit for Caring Act. As all of us know, caregiving is really an essential part of an MSA diagnosis. It can be quite, expensive, on top of just other costs, such as especially having to quit your job. So, and that's why this is a bill that's meant to give financial support to caregivers by specifically allocating a $5,000 tax credit for any expenses that are used, for the specific purpose of caregiving. So things that are like used for medical equipment. And it's a bipartisan bill that was introduced by Representative Linda Sanchez, Mike Carey, and then Senators Michael Bennet out of Colorado and Shelley Moore Capito out of West Virginia. And with that, we really just wanted to thank, everyone, for tuning in today, and hopeful, that this was educational and that we'll, see you as part of our advocacy efforts, moving forwards. So once again, thanks everyone.